Hello guys, so let's discuss our new topic, that is our dermatomyositis. And in dermatomyositis we know that it is what? It is the autoimmune condition. So it is the autoimmune connective tissue disorder. Autoimmune connective tissue disorder. That is what? Dermatomyositis. See, the dermatomyositis, it can be seen in the juvenile phase as well it can be seen in the adult phase. So it can be seen in the juvenile phase, and juvenile phase like we have the 5 to 15 year, and in the adult phase, as well, in the adult phase what will we be having? 45 to 65 year. So in the juvenile phase as well as in the adult phase we can see it. Also remember the dermatomyositis, what they involves? They involves the skeletal muscles. They involves the skeletal muscles. They involves the skeletal muscle. And also remember, mainly they involves the proximal muscles, the muscles that is present near to the joint, that is proximal muscles. So they involves mainly the proximal muscles, and that's why the patients will having the proximal myopathy. This patient, dermatomyositis patient, will having the weakness. This patient will having the weakness due to involvement of the skeletal muscles. It is common in female more than the male. So it is common in the females like 2:1 ratio. That's like 2 times more common in female than the males. Then remember, if we have the skin lesions, the important point here, if we have the skin lesions, if any patient having the skin lesions, but there is a no involvement of the, what? Skeletal muscles. Means no skeletal muscles involvement. If no skeletal muscles involvement, that means no weakness will be there. No skeletal muscles involvement means no weakness will be there. So the no weakness. So no weakness will be there, only we have the skin lesions. This condition is known as amyotropic dermatomyositis. Amyotropic dermatomyositis. See here, we have the A for absence, A for absent. Myotropic matlab that is muscles. Myotropic means muscles. Dermatomyositis, so absence of the muscles, that is what we have the amyotropic dermatomyositis. See, if we having the conditions like in mainly in like most of the patients will having the painless. Most of the patient have around 60 to 70% people, the 60 to 70% peoples, they having the painless symmetrical proximal weakness. They have the painless symmetrical proximal weakness. There is symmetrical proximal weakness. Okay. Then in around 20 to 30% peoples, in around 20 to 30% people, there will be the painful conditions. There will be the painful conditions, and it will be the like weakness. There is a weakness for weeks to 2 months. At least minimum 2 months will be there. Will be the weakness will be seen for weeks to that, but the condition here is the painfuls. And in most of the cases there will be the painless condition, but there is a symmetrical proximal weakness. On the both side we will see the proximal weakness. Rarely we can see that there is a standing presentations, but normally we will having this kind of presentations like symmetricals and the painful conditions. Then we have the, like, they involve the skins. They involve the skin. So this patient will having the skin lesions. So in the skin lesions, remember, they will having the Gottron's papules. They have the Gottron's papules. What are these Gottron's papules? They are the erythematous. They are the erythematous, flat topped. They are the erythematous flat topped violaceous papules. Violaceous papules. So they are the reddish color and the flat color, and the top violaceous looks like the, on the top of that looks like the papules, that is the violet color papules. So these are the Gottron's papules. Other than that, or it is mainly present on the MCP, PIP or DIP. I hope from the my last videos you already remember what is the MCP, PIP, DIP. So MCP we have the metacarpophalangeal joint, proximal interphalangeal joint, and dorsal interphalangeal joint. Then remember guys that if we are talking about the Gotran's papules, so we can also have the Gotran's ras. So they also known as the linear erythema. Like in the whole body we are seeing the redness that is Gotran rash, and these rashes are seen on extensor surface. This rash is also seen on the extensor surface. Okay, and other than like if any rash other than papules, that is come under the Gotran's rash, but it should not be the papules. If the Gotran's papules they are the erythematous flat topped violaceous papules. After the skin lesions, the Gotran signs it can involve the scalp, it can involve the anterior chest, and if it involve the anterior chest, we can call this sign as the V sign. What we call this sign? V sign. It can involve the posterior shoulder, posteriorly the shoulder and back. If we involve the posterior shoulder and back, we can call this sign as the sole sign. We can call this sign as the shoal shine. So on the sole shine, on the back side, we have the shoal shine. Okay. After the V sign and the sole sign, they can have the most characteristics, that is heliotrope rash. That is the heliotrope rash. So the heliotrope rash, what are these? See, these are like the violet bluish erythema. They are the violet bluish erythema. The violet bluish erythema. Okay, and due to like the heliotrope rash, it present like around surrounding the orbit. So there will be the periorbital edema. There will be the periorbital edema and erythema on surrounding the orbit, and erythema, that is erythema, periorbital edema and erythema. It is seen case like and it gives the appearance of the heliotrope rash. Okay, after along with that we can have the periungual erythema. We will see the image just after it. Then we can having the Holster signs, or like it is present around the thigh or near the thigh region mainly. So that is the Holster signs. So all these signs are important. Like it can have the Gotran's papules, we can have the Gotran signs, we can have the on the anterior signs where the V sign, on the posteriorly we have the posterior shoulder, we have the sole shine. Then we can have the heliotrope rash, periungual erythema, and the Holster signs. All these are the important. Now let's see the images. See, now it is looks like the V shapes. It looks like the V shape, so that we have the V sign. What is the This is what V sign. Now they present on the posterior surface. So this is what, that is the shoal shine. That is the shoal sign that is seen in case of all these seen in dermatomyositis. These are the heliotrope rash, and around the orbit we can see there is a periorbital edema and erythema. Erythema plus edema. Periorbital edema. Periorbital edema. Now what are these? These on the MCP or the PIP and the DIP. So these are the Gotran's. These are the Gotran's papules. These are the Gotran's papules. What they looks like? They are the erythematous, red or flat topped violaceous papules. Okay. Now this is what Holster signs. Now you can easily able to see this is Holster sign. This one, the complete one, that is what we have the Holster signs. And also remember, we can having the periungual erythema in case of dermatomyositis. What is the periungual? Ungual means nails. So around the peri means around, and ungual means nails. So around the nails, around nails. What we will see around nails, what we will see in the erythema or the redness around the, what we are seeing the something redness is there, like this type. Okay, so this is what we have the periungual erythema. So remember all these important points. I hope this video help you, and if you like this video, please do share with all your friends as well, and press the bell icon. If you didn't subscribe, if you are new to my channels, please subscribe my Medic Mukul, and press the bell icon so you can get all the updates. And if you have any query, you can write me on the Instagram, that is the Medic Mukuls. So bye bye, have a good day, and Hare Krishna.